In Southeast London, we recognised very early on that working in partnership to try to improve the outcomes for our population was going to require a fundamentally different way of us doing business, if you like, and that required us to understand what system working is all about. I'm not going to pretend for a second that we have all of the answers, but I think one of the things we realised was that it was going to involve really investing in building a different sort of capability, in particular, thinking about what leadership within a system means, thinking about cross-organizational working, thinking about relational types of leadership, moving away from perhaps the more traditional hierarchical forms of leadership that there were, and thinking about how we give people, particularly some of the clinicians and care professionals, but actually also some of the managers within our system, the capabilities, the skills, the tools, the techniques that they're going to need to think about working in a very different way, to tackle some of those problems in our communities, to address some of the inequalities that exist, but equally to move away from what had probably been characterized very often as a much more competitive arrangement within our different providers and organizations within the system, and move much more towards something collaborative, which is an awful lot easier, I think, to say than it actually is to do.